Hi, my beauties. Okay, so we're trying something new today. I'm actually in the office and I'm on my laptop. I'm about to start clinic in about 15 minutes. I start work at 8:30, and I wanted to do a live Q&A on YouTube because I was supposed to do it over the weekend, but I had a lot going on and wasn't able to get to it. And I made a promise. So whenever I make a promise, I need to follow through, and I definitely want to be consistent. And I think that live sessions and Q&As are really important because it's my way to interact with you guys and to talk to you in real time for those of you who have questions about anything, not only just skincare related, but just in aesthetics or dermatology or medicine. I'm like your own personal dermatologist who is here to provide truthful and honest answers backed by 20 years of education and training just in dermatology and medicine and the health of the human body. And I'm here to share that knowledge with you. It's kind of like my way of justifying spending 2 decades of my life just studying the skin and studying dermatology and studying aesthetics. And I can share this knowledge with people who are interested and who want to benefit from it. And I'm here to share that information with you. So again, just doing this live Q&A. I try to do my live Q&As on YouTube on Sundays because that's just a little bit easier for me with, I have two small kids and, just running these two businesses. It's sometimes hard for me to work it into, when I'm seeing patients and doing procedures in the office, but then also, when I'm with my kids and, we just launched a skin line last month and it just gets busy, but I wanted to be here for you guys to be able to answer questions. So I don't see any questions coming up. Oh, good morning. Okay, good. I'm so glad you guys are here. So if I see questions come up, I'll just answer them in real time. And I also think lives are good because it is in real time. And if you guys have questions, I'm here to answer them for you. And, there's a lot of influencers on, social media, YouTube, Instagram, and it really shows it's a testament to their knowledge when they can answer questions on the fly. And so I'm here to answer questions on the fly. I don't have to look anything up. It's all in my brain from 20 years of school. And I can talk about pretty much just anything in dermatology and skincare and recent advances and things that are coming down the pipeline in dermatology and aesthetics too. So let me just answer your first question. You're so cute. It has a little emoji with like the hand being raised. I love it. How can I treat chronic folliculitis on my rear? I also have KP on my arms, any OTC option. So this is a medical derm question, which I love. So chronic folliculitis is just inflammation of the hair follicle. And remember, we have hairs all over our body, not just, on our scalp, but we have it, on our arms, our legs, or buttocks. For men, they have it on their back. We have it everywhere. And inflammation of the hair follicle can happen anywhere. Sometimes with this patient who's asking this question, it happens on the gluteal region, and that can happen sometimes from an occlusive folliculitis that can happen with sweating, especially, if you're driving or if you're an athlete and you're playing sports or you go to the gym and you work out and you have, occlusive pants on, and it can cause inflammation of the little hair follicles on the buttock area. I think that that's what this person is talking about. I think the best thing to do is just wash with like a benzoyl peroxide, like a 10%, which is for body. Benzoyl peroxide less than 5% is for the face, but benzoyl peroxide 10%, like in the shower, just to have that antimicrobial effect. And then just shower right away after you sweat. So after you're coming back from the gym or if you play sports, that's really important too, to have like looser fitting clothes so that you don't have that occlusive folliculitis. And then KP on the arm. So KP is Keratosis pilaris. It's that those kind of like little white or red small papules or bumps that you get on the back of the arms most commonly. Sometimes kids get it on the cheeks, on the face. You can get it on the thighs too. KP just happens from it's a keratin, kind of like a retention keratosis, or the keratin protein in the skin gets retained into the little follicle, and it can cause little bumps and they can become irritated and become red. So decreasing your use of fabric softeners, decreasing your use of dryer sheets helps. And then also using liquid cleansers and not bar soaps in the shower is important. And then also a glycolic acid. So just like a over the counter, you can get it on Amazon, buy it anywhere. Glycolic acid for the arms will help debride that little like keratin plug that causes KP. So that's a great way to start the morning with a medical derm question. Okay. Good morning. Look forward to seeing this later since I'm at work. Okay, yeah, I'll totally post this. I know most people are probably at work, including myself. It's about 8:20 Pacific Standard Time. I'm in Newport Beach and I'm about to start seeing patients pretty soon too. But because I didn't post my Q&A live on Sunday, I wanted to do it today. So I'm going to keep going here until Stephanie, my amazing nurse, comes and grabs me to see my first patient. And somebody just responded that they love the vitamin C. So yes, I'm so glad everybody's loving it. So it's great to see people loving the products. So my vitamin C, for those of you who don't know, I just recently launched a skincare line. It's called MD Air, which is actually a very scientific name. Air is a anti-aging signal transduction pathway in the skin. And the vitamin C is a 15% L-ascorbic acid mixed with 4 other of the most powerful vitamin C formulations for the skin. And the delivery mechanisms and the stabilization and the bioavailability, because I engineered it myself and I know exactly what, vitamin C needs to be, delivered in as far as the bioavailability and the pharmacokinetics. It's really important because half the vitamin C's out there just sit on the surface of your skin and don't do anything, or they're like in a dropper and they get oxidized by the time they touch the atmosphere. It's not even stable anymore. Or if they are sitting on the top of the skin and they do end up penetrating through, they become unstabilized. So I put a lot of time and effort and research and dedication into formulating the perfect vitamin C, and everybody's loving it, including myself. It rapidly absorbs fast. If you guys haven't tried it, you can check it out on my MDR website as well and take a look at that. But people are loving it, and I'm loving that you love it. So let me get to some of these. Oh yeah, thank you. I have a desk job, so it definitely aggravates my skin. So I'm not sure what you were referring to. Oh, you're talking about the folliculitis that we were talking about earlier. We were talking about, you can rewind it back to see what we were talking about. But yeah, if you have a desk job, then definitely like try to stand up and take breaks and maybe wear looser fit clothing as well for the gluteal booty area. Hey, will you say this, please? I'm teaching 7th grade algebra. Oh my God, I loved math when I was a kid. Yes, I will definitely save this. So, and I will do this. I was going to try to be consistent and do this every Sunday for you guys, but life is unpredictable and I want to be able to do it. So I'll try to do a live Q&A on YouTube just once a week, but I'll always just do it spontaneous like this. I wish I could like announce and have like a very regimented, a schedule for me posting these live Q&As and doing these for you guys. But like I said, my schedule is highly unpredictable and I'm balancing lots of things. So I'll do it when I can, at least once a week, and I'll post it when I can. So hopefully you guys can watch this later. I love it. Somebody that you're an algebra teacher, that I loved math. Okay. My daughter is 14 and she's having terrible blackheads. Any advice? So 14 is actually not too young to get a facial. A facial can go a long way for especially like a 13 or tween or 14-year-old. And the reason is because there's a lot of congestion that can happen in the skin. And all blackheads are dilated pores with oxidized keratin debris inside that little follicular ostia. So the black part of it, like, when you squeeze it and it's like white and it's black on top, it just gets oxidized. And so what an esthetician can do is do like a hydrofacial or do like extractions with steam and just kind of decongest those pores. And then the pores can close up. Pores can't close and they create blackheads when they're full of gunk. So you have to take out that debris and then do things to cinch down that collagen and elastin fiber that's around the follicular ostia to shrink down pore size. So doing facials, I mean, my little guy's only 11, my daughter's 7, and I have them get facials like once a year or maybe twice a year just to keep the pores decongested, and then they'll start to shrink once the gunk is outside of the pores. Also, getting skin ready by Zio Skin Health is a really great protocol. It's basically a cleanser, exfoliating polish, and pads, and those help debride the keratin and the sebaceous debris and cellular debris that can clog the pores, causing blackheads, and then allow them to close. And then to close pores, that she's too young, she's only 14, but Fraxel, Clear and Brilliant, all those are just the mainstay of therapy, the best devices for closing pore size and making you have that poreless skin. Okay. Loving your skincare. I'm loving that you guys love it. I'm so happy that you guys are loving it. I'm so happy to have such great feedback from everyone. And again, I only have 4 SKUs. I have a hydrator, an eye serum, a vitamin C, and a retinol. And I try to engineer it so that they can be interchanged with other products, because we're always swapping out different products. And I'm a big proponent of just, using what products work for you, but then also using products from other brands. And I love the fact that products, when they're able to be swapped in with other products, as well. So I know that some skincare lines are like, only use the skincare line and it won't blend with other skincare lines. I wanted to have mine be very versatile and able to mix and match with other lines. But then also I wanted to just have the 4 most important products, the retinol, the vitamin C, the hydrator, and the eye serum, so that they could be used morning and night to simplify the routine. Because if you guys follow me on Instagram, I post my morning and evening skincare routine quite often. It can get pretty elaborate sometimes. So I wanted to include just like the 4 pillars, all you need. Use it morning and night. They can be interchanged. If you're using an eye serum from another brand or another vitamin C from another brand, it won't destabilize or undo all the goodness that another product's doing, and vice versa. So if you guys haven't checked it out yet, yeah, it's been my passion project for a long time, and I'm just so happy that I finally have it available to my patients and to myself. I'm like obsessed with it. All right, so how many passes for Clear and Brilliant is okay? So Clear and Brilliant, for those of you who don't know, is a very light fractionated, non-ablative resurfacing laser. Is it in this room? It's not in this room. So Clear and Brilliant is a great treatment to help even texture and tone. There's no pain, there's no downtime. And usually people do 4 passes with each wavelength. So there's 2 wavelengths on it. One that's more targeted for melasma correction, hyperpigmentation, ephelids, which we call, sunspots or liver spots. And then the texture one, which helps decrease pore size and helps eliminate fine lines and wrinkles and smooths the texture of wrinkled or laxed skin. So usually you do 4 passes with one wavelength or 4 passes with the other. But the Clear and Brilliant Touch, which is the newer platform, you can mix and match it. And so for somebody who's asking me how many passes I do, anywhere from 6 to 8, but I totally mix it up. And sometimes I'll tip the ratio one way or another. I never do the same thing on every patient because everybody has a different skin type. Everybody has a different, ailment that they're trying to correct, and different parts of the face will need different wavelengths and different ratios. Like the nose is highly sebaceous. Usually people have a lot of dilated pores on the mid face, on the chin, and the glabella on the forehead. And so I may do more, maybe 5 to 8 passes of just the 1440 on that one, and more, where they have like hyperpigmentation or melasma on the side of the face, I'll do more the 1927 there. So it just depends. I do something different on everyone, and I customize it for each individual patient. So a lot of people always ask me like my settings, how many passes I do, and I switch it up because I don't, if you go to a Medi Spa, they turn on the laser, they do a drop down menu, they do the same thing on everyone. I'm so like against doing that. I go based on endpoints. I go based on how their skin's reacting after one pass. I switch up the settings, I mix it up, I flip the ratios, and that's why my patients have next level results. So it just depends on the patient's skin type and what we're trying to correct. How many treatments have they done? What other products are they using? But in general, the textbook answer is you do 8 passes, 4 on each setting. But that's usually more for cookie cutter, Medi Spas or whatever. I switch it up and will totally vary with the amount of passes I do depending on the level that I'm doing and so forth. Okay, somebody says, I love your eye cream, so gentle. Oh, good. I'm so glad. Yeah, the ECM, which just stands for Extracellular Matrix Eye Serum, has active ingredients in it that stimulate your body to make collagen and elastin and to smooth that textured skin under the eyes. So for those of you who don't know, the under eye area is the first to show our age because it's such thin, delicate skin. It's the first, to show the signs of a collagen loss or elastin loss. So it's really important. That skin is so delicate and thin. If you look at it under the microscope, it looks very different than skin on the rest of the face. The dermis is thinner, the epidermis is thinner, there's no sebaceous glands. The histology is totally different, and that delicate skin needs different active ingredients than the skin on the face. And that's very important. So, green tea polyphenols and niacinamide, there's, polypodium leukotomas, topical melatonin, there's so many, and antioxidants. There's so many things that skin needs, not only to smooth the contour so that you don't have wrinkled, laxed skin there, but also to help minimize the appearance of under eye dark circles and hollows and puffiness and eye bags and things like that. So I made an eye serum that's all you need. You can use it morning and night or morning, noon, and night, and you don't have to use anything else with it. So I'm so glad that you guys love the eye serum. I'm obsessed with the under eye area. If you guys are my patient, you know that I've always been obsessed with that area. I have been since I was in my early 20s because, that's the first the area to show our age. So I'm always Fraxeling and lasering under my eyes and have been obsessed with eye serums my whole life. So okay, good morning. I was just wondering, is it really important to use a physical exfoliant on your skin every day? So you don't have to. And honestly, the thing with skincare and dermatology is you just find what works for you. I recommend, using an exfoliating, like a chemical exfoliating polish every morning, because morning is more important to exfoliate than evening, because during sleep, even though you would think evening you need to, exfoliate off all your layers of sunscreen or makeup or products, when you sleep, your cells are replenishing themselves. Your skin is like releasing sebum and exocytosing like oils and sebum and cellular debris and gunk. And in the morning, when you exfoliate that off, that's more important actually than they've done studies on this than exfoliating at night. But then again, you do what's best for you. If you want to exfoliate once a week, if you want to do it once a day, if you want, I wouldn't do it twice a day, that'd be too much. If you want to use a chemical exfoliant, if you want to use a mechanical exfoliant, it's totally up to you. There's no right or wrong way, and everybody's skin's different. So keep that in mind. If you have a friend that has a certain, regimen that works for her or him, you don't have to do that, and your skin may respond a little bit differently. So you don't have to use an a physical exfoliant every day. Although I do, and I recommend it. But you can also just use like an alpha hydroxy acid, like glycolic acid or lactic acid, every morning, and that's a chemical exfoliant. And you don't have to do that every day. Maybe you do it once a week. Your skin will tell you by the way it's responding, and just a little irritation is okay, but too much is just not necessary. So I hope that helps. Okay, doctor, how long are the skincare for? I've used them for a month and almost done. Skin better, same sizes, last me 2 months. Thank you. So each individual product is engineered to last about a month, but it just depends on how many pumps you're using and if you're using it morning and night. I know with Skin Better Science, they have more morning, like Alto is more morning and Alpha it's more evening. So that may be why, but for pound, it should be pretty equivalent and similar. But I did engineer mine so that you can use it morning and night, and it should last for about a month. Now, if it's sitting on the shelf, it's good for about 6 months to a year. But usually, if you're using it appropriately, you should go through it in about a month. So I hope that answers your question, and thank you for following. Hi, Dr. Capel. Thanks for all you do. Can you share with us how much SPF you should wear? So remember, SPF is important for UVB rays, which cause skin cancer. And that's really important. Of course, I'm a Mohs micrographic surgeon. I'm a skin cancer surgeon also. So all about skin cancer prevention, which is SPF is related to. However, UVA, which causes photo damage, aging, fine lines, wrinkles, melasma, brown spots, is UVA, and that has nothing to do with SPF. So don't get too hung up on an SPF. They say 30 and above is recommended, but in 2022, I feel like that doesn't really mean much anymore, because you can have an SPF 100, which is protecting you from the UVB rays that can induce skin cancer, but you're having no UVA protection. So for example, I sometimes see patients in my office who have really horrible melasma, and they're like, I'm wearing like an SPF 100, but they have gaps in the UV protection spectrum from their chemical sunscreen that's not blocking the UVA rays that are stimulating the melanocytes to hyperpigment and create melasma. So it's really important to look at the broad spectrum. You want a broad spectrum mineral-based sunscreen. So an SPF is okay. They always say 30 and above, but I use 50 and above personally, but I also use mineral-based sunscreens. So zinc oxide, titanium dioxide, because there's no gaps in the electromagnetic spectrum in which it covers, and it reflects the light off. It doesn't absorb it. And then also another key thing to look for in your sunscreens that has nothing to do with SPF are iron oxides. So Tizo, Color Science, Skin Better Science, these all have iron oxides in them, elastin hydratant. And the iron oxides help protect your skin from free radicals in the environment, and also from HEV light emitted from our devices. So with this generation, when they're older, people like all the Gen Zs and alphas coming up, there's a lot of exposure to infrared blue light and high energy visible light that can break down collagen by increasing matrix metalloproteinases, which degrade collagen and elastin and can cause premature aging. So it's important to have iron oxides in your sunscreen to protect you from that too. So I just say, if you want an SPF, I would say over 50, but there's way more to the sunscreen than just the SPF. You want to have a mineral-based sunscreen that's 7% or higher. That's just from the American Academy of Dermatology. People ask that all the time. At least look for 7% or higher. If the zinc is 7% or higher and the titanium is only 2%, that's okay. At least one of the two have to be at least 7. So that's my recommendation. Okay. Oh, you're so sweet for somebody saying everyone hit the like button. Yeah, everybody hit the like button and subscribe. Then you'll get a notification when I just randomly, spontaneously come on and do a live Q&A, since I'm so unpredictable. Okay, I just want to be able to get it in when I can. And I wish I didn't have well, I mean, I love what I do. I love that I have a medical practice and I'm seeing patients day in and day out. And, this is my primary job, but I also have such a passion for sharing education and educating you guys. And I found my family who loves skincare as much as I do, and who can talk about skincare all day long like I can. So I found my people. So it's been such my pleasure to do this. I just wish I could do it at a more consistent basis, but I'll try to. Maybe Tuesday mornings before I start clinic at 8:30 between 8 and 8:30 is ideal. So we'll see. Okay, so somebody says, thanks for all you. Thanks for all you do. You're welcome, you guys. I love you. Okay. Do you have any advice or opinions about tear trough filler? I'm on the fence about getting it, and you should be. It's a high risk area, and you have to go to an expert injector. I'm on the fence about getting it because I feel like I have volume loss there, but I'm too nervous about potential side effects. So yeah, tear trough fillers they just got, so Allergan just got the first FDA approval for it. They call it under eye hollows for Vobella. And I actually sat on the advisory board for Allergan, which was a great honor because there were only about 15 to 20 of us, and they were all from all over the world, all the world experts who have been doing tear trough filler with the highest volume and the best outcomes. So I've been doing tear trough filler since got my residency. I trained at UCLA. I was at a prestigious program, so I'm very lucky and blessed to have had such amazing mentors and training experiences. But I've been doing tear trough filler since probably 2010 or 12. And so I'm very, very comfortable with it. I use a cannula to ensure safety. I would say it's very safe if you're in the hands of a skilled injector. And at the advisory board meeting, what we all recommended Allergan to do is before people are able to buy the product or perform the procedure, they have to go through strict education, training, pass a test, because any injector can grab a Vobella and hit you under the eyes and bruise you and have all these complications. I mean, it can potentially cause blindness if it's not done correctly. And I've had colleagues who have actually had phone calls from a med spa down the street blinding a patient, and then the dermatologist has to go in there and reverse it. And if you don't know how to reverse a complication from tear trough filler, you shouldn't be injecting patients. Do no harm. Don't do anything that you're not comfortable with. And for patients, it's hard to tell who's comfortable or not because everybody's a so-called expert or a board certified dermatologist, even though they're practicing dermatology, but they're board certified in OBGYN and wanted to retire early and open a med spa down the street. It's so hard. And that's where my passion comes in too, because it's so hard for patients to know who to trust and who not to. So I would say, ask somebody, what their experience is, do they use a cannula? And if they don't, are they able to? Because cannulas, you take a little extra training to learn how to do. Not every provider uses them because he or she may not have the extra training to know how to use them. And then just look at before and afters, and don't be afraid to ask your provider, how long have you been doing this? And how do you plan on reversing a complication if this happens? And how, what products do you use and why? And where did you do your training? So I love it when people ask me this. I'm like, yes. And most of my patients do, because by the time they come to find me, they've done their research and they've landed in my office for a reason. So don't be afraid to ask your provider. And if you get a weird vibe or you feel that they're hesitant or uncomfortable, you can kind of sense it. Just walk out the door and you know that you'll be safe. I would say only trust a oculoplastics dermatologist or a plastic surgeon to do your tear trough filler. And again, somebody who's been doing this for a very long time, because the risk could be catastrophic, but the results are beautiful. I mean, I do tear trough filler all day. I do, probably 10 to 15 cases almost every day, and it's second nature to me, but it may not be for somebody else, and that's the person that you need to will look out for. So don't be afraid to challenge your injector. Ask about credentials, ask how comfortable they are, and just challenge them, and you'll get a sense as if they're comfortable or not. And if they're not comfortable, they shouldn't be doing it in the first place. It's unethical. So sorry to be the dermatology police, but I have your back, you guys. I really am very, very passionate about this, because I also am on the receiving end. When things go wrong, they get sent to me. And so it's just, I want to protect you guys from bad things happening to you. Okay. Do you have everyone? Oh, I already read that one. A favorite self tanner, please. Oh gosh. I've used, San Tropez for a long time. I love South Seas. They have like a sea foam that's a really, really, beautiful color. I use it on myself. I usually go get a professional spray tan, maybe like every other week, because I don't think my skin's ever been in the sun and gotten a real tan, but I love having that tan bronzed look. But I use a brand I'll probably include. I'll link it in this video. I think it's called South Seas, and I like San Tropez too. Although San Tropez has been around for a while, but my skin really responds to it really well, and it doesn't have like a weird smell, and it lasts for a really long time. Even though I use AHAs and BHAs on my neck and chest, it doesn't seem to make my tan look splotchy or uneven. So I love that. And the best thing about non-UV tans is, I live in Laguna Beach. My son's a surfer. I'm on the beach. I surf with him. I'm in my bikini every weekend on the beach, all year round. It's pretty much sunny here. But the thing that I'm really thankful for is my mom taught me this early. I love the look of being tan, but having a spray tan with a ton of sunscreen on, it looks a lot better as you get older. Now that I'm older, I don't have brown spots and I don't have chest creases and I don't have crepiness and I don't have like sunspots on my shoulders because I've never been in the real sun. I've always been tan, but it's been an artificial tan. So that starts to catch up with you. I'm in my 40s and like now I'm so glad that when I don't have a tan, I just have white, pristine skin without blotches and, sun damage and brown spots and all that stuff. So really invest in a good UV tan. And I'll link the one that I use, but I'm pretty sure that all of them are pretty good, in today's world because the technology has gotten so much better. They dry rapidly and they don't have that weird smell like they used to. So I hope that helps. Okay, best laser for redness. Oh, it's this one right here, V-beam. He's right there. He's so cute. So yeah, so V-beam is probably the best laser for redness. There's lots of different lasers though that can help with redness and telangiectasias, flushing, rosacea, and things like that. But V-beam, which is a 595 nanometer wavelength laser, targets the redness and targets facial vessels, flushing, rosacea, things like that. Even like erythematous or erythematous means red in dermatology, red acne scars, things like that. But other good get the red out lasers besides V-beam is the XLV and KTP. There's other ones that are great. I'm not a big fan of IPL because IPL is just kind of like a sloppy, like wannabe laser. It's like a broadband light that you put a filter on and it like can kind of get you out of a quick, kind of give you a quick fix, but there's no really like long lasting results. And sometimes it often makes pigmentation worse. So I'm not a big IPL fan. But I would say KTP, V-beam, XLV, and I think V-beam is the standard of care, which is why I have a V-beam, and it's also known as pulse dye laser. Okay. Oh, there's so many questions. I hope I get to all you guys. Okay, how do you make sure your hair extensions aren't causing alopecia? Do you wear them constantly? Are fewer sewn points on the scalp beneficial than spreading them over the surface area? So yeah, and changing it up. So I have the natural beaded rose extensions. My hair is actually really long naturally. Like I have long hair, but it's thin. Like my real hair is probably like only like my ponytail would be like this big instead of like this big. So my extensions really save me a lot of time and they're so easy to care for. And they're basically like braided and sewn into your real hair. So there's not much traction. And when my stylist puts them in, she moves around the place every time. So it's not like in the same place putting tension on it. So I think that the hand tied hair is a lot easier on your scalp. It doesn't cause alopecia. And it's just my actual hair, like when they take my extensions out, it has gotten a lot healthier. It's like thick, it's long, and it's beautiful. I just love wearing the extensions because it holds when I curl it with a wand, it holds it longer, and just having longer hair makes it just easier when I'm trying to race around and take care of my two little munchkins and trying to balance work and being a mom and swimming and not having much time to like style my hair or do makeup or get ready for that matter. I literally jump out of bed and I just go. So thank goodness for extensions, microbladed brows, Fraxel, and good skincare products for skin and lash extensions. So it saves time. But I think that the most important thing is try to get hand tied hair instead of the tapes and try to move it around. Whoever is putting it in and do your install, just have them move it around. And I think it shouldn't cause traction alopecia too much. Can you discuss the benefits of superoxide dismutase for skin and body? So superoxide dismutase is, that's a great question. It's an active ingredient. It's one of the natural moisturization factors in the skin. It's an antioxidant. It binds free radicals. So it's a free radical scavenger. So a free radical scavenger like superoxide dismutase is really important to decrease the enzyme, which is the matrix metalloproteinases, which degrade collagen and elastin in the dermis, in the extracellular matrix. So basically what the benefit of it is that you're having like a basically little policeman go around in your skin and bind up free radicals and halt the process of degradation of collagen, which can cause fine lines and wrinkles over time. So that's why it's important. And I'm glad that you asked that question. That's amazing. Okay. Can you talk about azelaic acid for preventing acne and acne scars? Any plans to add one to your skincare line? I do have azelaic acid in my, azelaic acid in my vitamin C. So yeah, I do actually have azelaic acid in my skincare line, and it's a great way to. It's actually inhibits the melanocyte synthesis pathway, so it helps. It's a natural way to decrease melanin production in areas where there's hyperpigmentation or melasma. So azelaic acid inhibits the melanin synthesis pathway in a different mechanism than hydroquinone does, and it helps decrease hyperpigmentation, hyperpigmented acne scars, things like that. So it's a great active ingredient. It's also a natural antioxidant, and I have it in my products as well. So for those of you who just have a regular azelaic acid, it's usually used in a lot in pregnancy because it's safe for pregnancy and it helps with hyperpigmentation. And the trick is to put it in the fridge because it makes it sting and burn less. So my team's calling me because I have my first patient, so I have to go, you guys. But I'll do a live Q&A like this. Maybe Tuesday mornings works if it works for you guys. Maybe I'll do this every Tuesday morning. But I'll definitely post this. I'm sorry for all these questions that I couldn't get to. Oh, you guys are so sweet. Okay, let me see. I just want to make sure I got to most of them, but I'll post this so you guys can watch it later. And again, I'll try to do this once a week because I'm your own little personal dermatologist who's here to share education and be a source of truth and honesty in a world where there's so much hype and marketing and misinformation and fake science. I want you to be able to like come to me and be like, okay, Dr. Cabell, like, is this true? What is this? Give me the real deal and the real information on this product, on this procedure, or whatever. And this is Deb. Okay, I gotta go, you guys. But I'll be here to answer your questions hopefully once a week. And I love you. Thank you for watching. Hit subscribe and hit the bell and be sure to like it and share it with your friends.